Thank you so much for having me. This is super exciting to be here for Batten Hour, and really excited to be able to present to you on my work. So I'm going to talk about protecting kids and the cross-section between healthcare and firearm injury prevention. I can't see my own slides. Oh boy. Okay. So I just want to start off. We're boring. We always, as doctors, start off the same way. And I'm going to start off with a case of a young boy I saw. And so this was really early on in my career. I saw a boy in the ER. It was while I was working in the Bronx in New York. It was a community ER. And he was about 4 years old. And he came in for fever. Really simple, really common complaint in the ER. And as I looked over from the nursing station, as I do, just to kind of see how they are before I walk over and they start crying, I see he's like waving his hands around and joking with his mom who's sitting next to him as he's lying in the bed covered with a sheet. And I'm like, okay, easy peasy. I walk over and I take my history. And as I always do, my last question is there anything particular you're worried about today? And the mom says, no, it's just that ever since he was shot last year, we have to bring him in every time he has a fever because we have to check for urine infection. And then I paused and, I was like, oh, I should have read his chart before I walked over. But I look over and I see that behind the curtain, there's his wheelchair. And then I noticed that he has not actually moved his legs under that blanket, even though he was cracking jokes and very animated. And I learned from mom that a year prior, he was playing outside his house and he got hit by a stray bullet and was paralyzed from the waist down. And so every time he has a fever, for a normal uninjured kid could just stay at home and get some Tylenol, mom had to bring him in to get his urine checked because he needed a catheter every time he wanted to urinate. And I would love to tell you that this was the moment that changed my career. But unfortunately, I treated him like I treat every other patient with a broken leg or asthma or diabetes, and did what I needed to do for him and kept on with my career. And that wasn't my oh wow moment. But unfortunately, he was not alone. So this is an article that was published in the New England Journal of Medicine 3 years ago, which is a very big deal for us, by the way. That's like top tier. And this was the first article that showed that firearm injuries have become the #1 cause of death in kids in the United States. So as a doctor, to me, to see all the kids that I see with cancer that, we can't do anything to prevent cancer, with diabetes, and we can't do anything to prevent diabetes. And we can't do anything to prevent so many of these injuries. And to see that firearm injuries had become a leading cause of death more than any of these things was astounding to me. And on top of that, it had been the second leading cause of death for such a long time that I think saying it's the leading cause of death and this is when we should pay attention was really a very big problem. Now, why did that happen? Sorry, I'm going to go back here. There's two things that are happening. One is that you could see from 2019 to 2020, firearm injuries rose, right? And so that's part of what made it the leading cause of death. But there's something else happening, and that's that motor vehicle collision deaths decreased by 50% over 20 years. So let's not just notice the firearm injuries, but let's also ask ourselves, how did motor vehicle collision deaths decrease so much? And can we emulate that for firearm injuries and perhaps use the same approach to decrease firearm injuries? And so the answer is that we took a public health approach to motor vehicle collision deaths. And so what does that mean? That means we don't just look at the car and say, we need to take away the car and we need to take away the driver's licenses. We say, how can we make driving as a whole, not just cars, but driving as a whole safer? And so we approached it from many different angles. So we looked at alcohol and restricted alcohol sales to underage drivers. We said there are going to be maximums on how much someone could drink before they get into a car. We looked at strategies around driver safety, like graduated licensing, like car seats and seatbelts. We looked at interventions on vehicle safety, so anti-lock brakes and airbags. And so for the engineers out there, if you have some ideas on gun safety, I'll be happy to hear about them. And then there was a targeted approach to problem drivers. So if someone was reckless with a car, then there was something punitive. But really looking at it, we were able to study what worked, find different solutions, and then implement the solutions that worked. And so the result is you see a 50% decrease over 20 years in firearm injuries. And then the question is, why don't we do the same thing for firearm injuries? Did I 50% decrease in motor vehicle collision deaths. I apologize. This is going to be my only foray into politics because I have seen the speakers you guys have here. So I'm not diving deep here. What happened was in 1996, Congress passed the Dickey Amendment, and that was something in the spending bill. And please don't ask me the difference between a budget and a spending bill. Again, not a politician. But basically, they put into the spending bill a rider that said that none of the funds available in this title can be used in whole or in part to advocate for gun control. Fine. But the way this was translated was that no funds after that time went to gun research. And so the money that was allocated at that point in 1996 for gun research, for firearm injury prevention research, was reallocated to traumatic brain injury. And then what you see is that for the next quarter of a century, we do not have any research into firearm injury prevention, that no funding that's coming from the federal government. And there are consequences to that. But that way, then in 2018, after the shooting in Parkland, Florida, they clarified, oh, this actually does not apply to research. And so in 2020, a quarter of a century after they first said, let's treat this as a public health issue, we start to see the first funding going to research again, which kind of worked out for me because I started getting funded in 2023, but that is besides the point. And so what's the consequence when you don't fund research is that things don't get researched. And so this looks at the top 30 leading causes of death in the United States. I needed to check that it was the right slide, right? And so if you look at the top 30 causes of death in the United States, we see that firearm injury prevention is the second least funded and the least researched cause of death in the United States, despite the fact that it is killing more kids in the United States than any other illness or injury. And I'll tell you what, if you don't have research to study solutions and see what's effective, you are not going to see any change. But let's get back to where this is affecting kids, because that's my lane. This is 2021. So this is the latest data we have on firearm injury deaths, on injury deaths in general, which is a whole other problem unto itself. In 2021, firearms killed 4,752 children in the United States. Now, if you remember that graph that I showed at the beginning, where it became the leading cause of death, it killed 3,390 kids. So in that 1 year from when that study was done, there was a 40% increase in deaths in children. This is all children, right? 0 to 19 in the United States. So we kind of let that happen. And for me, I hear statistics and read studies all the time on lots of different things, whether willingly or not. And it's really hard to understand such big numbers. So let's try to understand a little bit more of what this means. You could fit, if you really cram in some little kids, 72 kids on a yellow school bus. This is the equivalent of 66 school buses a year crashing and every single child on that bus dying. So imagine we had a yellow school bus crashing every week in the United States and every kid on board died, and we didn't stop and think, we should do something about the school buses. So that is what we are seeing right now in the US. And there are huge disparities, as hopefully we all know, in who is injured by firearms. So again, I'm going to keep referring to that graph. I should get some royalties on that study, but we saw that in 2020, firearms became the leading cause of death in youth. That has been a statistic for at least 20 years for Black youth. So firearms have been the #1 killer of Black youth in our country since at least 2001. And we know that a Black child is 4 times as likely to die from their firearm injury and 18 times as likely to be injured by a firearm. And even though the Black population makes up 7% of the United States, they make up 52% of homicide victims. I think we also need to talk about non-fatal firearm injuries. I think there is so much emphasis on why this is important because kids are dying, and that does make it important, but it's also really important because the survivors are hugely impacted by firearm violence. And so we know that in the year after their injury, kids who have been injured by a firearm have increased risk of mental health issues. They have increased risk of anxiety and depression. But more than that, they're also being seen more with substance use disorders and traumatic disorders and disruptive disorders. And so imagine that child who was injured by a firearm who now goes back to school and is disruptive in school, and then they get in trouble from the teacher because they're being disruptive in school, and maybe they get expelled or suspended from school, and now they're not having socialization. So I think we really need to think of this broader scheme of things, a broader scheme of how they're impacted. We also know in the long term that there is increased risk of depression and anxiety, both in children and in adults. And then here's something that also shouldn't surprise us. You don't have to be a victim of a firearm injury to be impacted by firearm injuries. So there are some really nice studies that actually have geocoded. They look at where homicides occur and then where children live and go to school. And they show that even if you live or go to school in an area where a homicide occurred, you have increased risk of depression, anxiety for girls, and anxiety for boys. And that relationship was even stronger the closer you were to that firearm injury, to that homicide. Now, partly, probably because there were gunshots near you, probably because there was a homicide near you and you're scared to go to school. But also thinking again of how kids grow up. If they are growing up in a neighborhood where there are frequent homicides, where there are frequent gunshots, maybe their parents don't want to let them go down and play outside. And maybe they're sitting by themselves at the TV. And maybe they're scared to walk to school. Like, no child should ever be scared to walk to school. That should be their safe space. So these impacts of gun violence go far beyond what we're seeing when we see leading cause of death. I'm going to take a segue here. I really wish I took a better picture this day. I had no idea what a huge impact this day would have on my life, because here I was treating these kids, as I said, the same way I was treating asthma and diabetes and broken bones, treating them for the injury they came in with, treating them for the complaint they came in with, but actually not doing anything beyond that and not really understanding the bigger issue. And then we talked about Parkland in 2018. I'm not sure if you guys remember, you must, that the teens from Parkland, Florida, organized these big rallies across the country. And at the time I was still living in New York, and it was like half a block from my house, and it was Saturday, and it was a nice day. And I just went to go take my kids out of that really small apartment for a day. And that day in the end turned out to be a turning point in my career and in my life. I went there and I looked around me. There were tens of thousands of people lining Central Park West. And there were kids who were holding up signs that said, "Protect us, not books." And there were teenagers coming up to the microphone saying that they were scared to go to school and that their parents were scared to send them to the playground. And I was like really surprised by all of this. And I'm ashamed to say that. I should have known. And then there was one girl who got up, she was probably 14, and she talked about how her brother had been shot and killed walking to school, again, by a stray bullet in their neighborhood. And I thought, wow, like I have committed my career to caring for children and I have completely fallen down on the job and I need to be doing more. And that was a pivotal point for me. And if there was any question of whether I could be doing more, here were teenagers who organized 2 million people across the country to rally a month or two after a shooting at their school, while they were still reeling and grieving from that shooting. And certainly if 16 and 17 and 18-year-olds can organize this with no specific training and no career, I could be doing something more. And so I do have to be doom and gloom just to convince you there's a problem, but I do think there are a lot of people who are working to make this better. And so starting off, I really looked at the advocacy group. So things that already existed like Moms Demand Action and Everytown for Gun Safety. And there's a lobby group in our state called Colorado Ceasefire, which I think exists in some other states. And I was like, okay, potentially I could work with them. And I have no shame. So I started like contacting anyone who did anything and just started meeting with people. But then I thought, yes, this is amazing, and it's one thing I could do. But I see patients and their families every single day. I see children, many children every single day. And how can I capitalize on that opportunity where I actually have direct contact with kids every day to actually help solve this crisis? How can I capitalize on that opportunity with my contact with youth to decrease firearm injury in kids? So I'm going to go to another case, you guys. This is one kid, but this is also a kid I see on almost every shift of mine. So this was a 14-year-old boy who got into a fight with his dad. It was something about homework, and dad took away his cell phone. I know. The kid was very upset, ran up to his room, and in that moment of crisis, he took a handful of Tylenol and a handful of Benadryl. And 10, 15, 20 minutes later, he regretted his decision. And he went down and he told his dad what he had done. And his dad brought him in to see me. We treated him medically. He was admitted to the hospital for a couple of days. And then he was admitted to a psychiatric inpatient unit and hopefully will never attempt suicide again. And this was only possible because in that moment of crisis, he did not have access to a gun. Every time I see a kid who has attempted suicide and survived their suicide attempt, I'm very thankful that in that moment of crisis, they didn't have access to a firearm. Firearms are the most lethal means of suicide. So even though they're used in less than 5% of suicide attempts, 90% of the time, if they're used, the child will die. So they're responsible for nearly half of suicide deaths in children. This is all children, even though they're used in less than 5% of attempts. So compare that to medications, which are responsible for only 2% and are probably used in 80 or 90% of suicide attempts. So in my practice, what I'm mostly seeing is kids who have taken pills, and then after they take pills, either have remorse and tell a parent. Sometimes they post something on social media, a goodbye. Sometimes they text a goodbye to a friend, but there is some opportunity there for us to intervene. We do not have that opportunity if a child uses a gun, if they could get a gun in that moment, because 9 out of 10 times, if they use a gun in their suicide attempt, they will die. The other thing is that many of these attempts are impulsive. So there might be a simmering depression or anxiety, but usually there is some crisis and there is a decision to attempt at that moment. And so 70% of the time, that suicide attempt will occur within 1 hour of the crisis. Almost 50% of the time, it will occur within 10 minutes. And so that impulsivity is really important. Dying by suicide is not inevitable for most people that attempt suicide. So you'll hear a lot of people say like, oh, if it's not a gun, they'll find some other way. That's actually not true. 90% of people who attempt suicide will not go on to die by suicide. 2/3 will never attempt suicide again. And so what's really important here, lethal means safety planning. And I'll tell you, by the way, these statistics are true for adults too. So friends, adults, this is true. This is just across the board, not just for adolescents. And actually, the studies were done in adults, and I imagine that for our rather impulsive adolescents, the numbers might even be worse. And so what does this mean? This means that in that time of crisis, if someone is having a crisis, you want to put time and distance between them and a gun. And so putting time and distance means that you're either going to delay the attempt until the impulse passes. So they're going to look and look and look for that gun, but not find it. And so they won't attempt with a gun, or divert to another means. So instead of using a gun, they'll use medication or pills, but then they have time to have remorse and tell someone or ask for help. There is no time to ask for help if you've used a gun in your suicide attempt. There are just no second chances. Now, part of this is about home firearm access, because 80% of kids who attempt suicide with a firearm, and this part will be different for adults and adolescents, of course, 80% will use a firearm from their home. And so part of this is talking to families about how they store the firearms in their home. And more important than knowing how they store the firearms, because it isn't about the firearms, I want to know, how are they limiting their kids' access to firearms? Because a kid can't use a gun that they can't get. Now, we know that having firearms in the home, I mean, 40% of people have firearms, very normal in the United States. And that really is going to obviously depend on where you live, what part of the state you live in. We also know that that doesn't differ if you have a kid in the home or not. But we know that that risk, having a firearm in the home, is associated with a 3 times increased risk of homicide and a 5 times increased risk of suicide. Again, you got to have a gun to use a gun. But that risk can be mitigated. So any element of storing your gun locked, unloaded, ammunition stored separately, and each of those individually can decrease the child's access to a gun and prevent them from harming themselves or someone else. So each of those things decreases your risk of an intentional or unintentional injury. And I think that's really important, because I think there was a move at the beginning to say you have to do all these things to be a responsible gun owner. And I don't think that that's compatible with a lot of people's reasons for owning a gun. I don't think it's compatible with people's values. And I think if we really want to meet somewhere in the middle and we really want to help people keep their kids safe, we have to be listening to them and help them store their guns more safely and help them keep their kids away from their guns. So let's talk about violence exposure. So this was a 15-year-old boy, and we have a violence interruption program, and I'll tell you a little bit more about that. But I was trying to get our ED docs to use this violence interruption program and get community workers out to our hospital. And if you couldn't tell already, I love stories. So I told them, I said, because our ED docs, we asked them to do so much, and I needed to show them why this was important. I'm just trying to prove to you that it was okay for me to ask for a story. And so I asked our violence prevention workers, I said, can you tell me a success story of a child who came to you so that I could show my docs how impactful your work is? And so they sent me a story of this 15-year-old boy who came into us with a gunshot wound and ended up following with our violence prevention workers. And he was doing great and attending their groups and getting mentorship and really finding some hope and some purpose in life. And I was super excited. And to get a bit more of the medical slant, I looked up his chart and was not surprised to see that 3 weeks earlier, he had come in with an assault injury. So he got into a fight and had broken his hand. And why wasn't I surprised to see this? Because kids who come in with one injury are at higher risk to get re-injured. And those injuries are typically of escalating severity. So first time, they're going to come in after a fight at school. Second time, they're going to come in with a stab wounds. And then the third time, they're going to come in after they're shot. And if that shooting is in the leg the first time, it might be in the head the next time. And so what we need to do as clinicians, and we also need to do this as a community, is identify these kids earlier. We could refer them to violence prevention programs. Anyone can identify these kids earlier and see how we could support and mentor them. And so these violence interruption programs, and I think there was someone who spoke here recently, but these violence interruption programs are really multidisciplinary groups. And so what they do is they are able to provide services to people in the hospital and come in as a trusted worker. Often it's someone from their own community that can relate to the child. And we have these in about 60 hospitals across the US. And what they do is build on that teachable moment. So the first time this child comes in with a broken hand, identify them then. Identify that they are at higher risk of re-injury, that they are at higher risk of escalating re-injury, and that they are then at higher risk of perpetrating violence. And we know that when they come in with that injury, they're more prone to actually be open to behavioral change interventions. So if you come in while they're not injured, they might say, I don't need this. But when they've actually been injured, that's a bit of a wake-up call. And they might say, okay, maybe I do need this. Maybe I see that this is a teachable moment and I could do something differently. The other thing is that a lot of these youth who are at higher risk are also mistrustful of mainstream institutions. So they might be mistrustful of the doctors, they might be mistrustful of the criminal justice system, and so they might not relate to us as they relate to someone else. So as much as I would be happy to mentor them, that's not what they're looking for, and they need the right person. And as I said, many of these violence prevention professionals come from the same communities, and they could often break through that mistrust to offer services. And so they come to the bedside or they see them soon after discharge. They're able to offer planning services. They're able to help with immediate safety needs, and they set goals for after discharge. And the beauty of this is that unlike me, who will never see them again, I hope I will not see them again, they could see them again after discharge, and then they provide services after discharge. So there really is a continuity of care as well. And again, addressing their safety needs, but also working beyond that to develop a plan for them, build resilience, and help to address kind of the things that are affecting them negatively, like substance misuse, chronic unemployment, but then they could also help promote these protective factors like education attainment, help them find a job, help them with social services, and provide mentorship for our youth. And that is really, really crucial. So I actually, in my work, had an opportunity to have a conversation with our Director of Office of Gun Violence Prevention. And this was a really enlightening conversation for me, and one that I use to help inform my residents and my trainees, because what I really want them to do is also approach these youth who have been shot with empathy. They are victims and they are our patients, and I feel that they're often not understood. And often there's well, was it their fault? And it wasn't their fault. And so I do want to share a little bit of what he told me. He described to me what it was like to grow up, and I am taking his words here, against a backdrop of violence. And there was a lot of violence in his neighborhood. And what he described to me was one kid who was older than him that he really looked up to. He was a high school athlete. He did really well in school. And he ended up going to college, which I think for his community, that was a really big deal. And he looked up to him. And he came back from college one summer and he was shot and killed. And when he told that story, he said, that was a pivotal point where I understood what I want to take his words because I don't want to shift any of that. He said, I internalized the narrative of what it was to be a Black man in the US. And what he told me then is that he understood that he was less likely to go to college, more likely to get shot, and more likely to die before the age of 25. And that impacted his life moving forward. And he got involved in violence. And as he explained it, and this is what I tell my residents all the time, he made the best decisions he could with the choices he thought he had. And so the importance of understanding where people are coming from. No one is choosing violence over going to college. People do not understand that that is an option for them. And the last thing he told me, he said, Maya, as we were leaving, he said, Maya, you have no idea how much the role of a caring adult reduces the likelihood of being involved in violence. So I challenge you all. This does not have to be a doctor. Actually, preferably not, because again, like I don't know what we each have a role to play in this. And just being that caring adult and recognizing that people are not involved in violence because they had great other choices. If there is one thing that is true across all firearm injury, there's not a lot that's true across all firearm injury. The solutions are going to be different. The treatments are going to be different. The help people need is going to be different.